Will come to order. Please rise and join me in pledging allegiance to our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. I think most of us just got a copy of the meeting minutes from January 14th, 2013, prepared by our Radnor High School intern, Claudia Cardamone. And if you take a minute to review it, I'll entertain a motion to approve. Well, let's have the motion and then we'll discuss it. Thank you. Any one move to approve?
I'll move to approve.
This has been motion to approve by Dr. Donato and seconded by Ms. Wishner. Any corrections, additions, deletions? Ms. McCarthy.
Where it says the Board of Health welcomed 2 new members, am I missing something after that? Under announcements?
No, you just have done so much for us since your appointment that it seems like it's 2 new members. So,
Thank you, sir.
we'll make that correction to 1, welcomed a new member. Thank you for that correction. Any other corrections, additions, deletions?
You know, I think I may have missed that meeting.
Let's see.
I had an excuse list.
Well, if you don't think you were here, then certainly we'll take you
That was
from.
your first meeting. No.
Yeah, that was, yes, you were not here.
Right.
So again, we'll change that to indicate that Dr. Humphrey is under those with an excused absence, which is basically everyone who was absent at that meeting. Okay. Any other changes? Hearing none, all those in favor of approving the minutes as amended, say aye.
Aye.
Any contraries? The minutes are approved as amended. Dr. Andrew Foreman, a member of the board, and Dr. Madeline Saldivar emailed me that they were unfortunately unable to be at tonight's meeting. So they are excused absences. Before we go to Mr. Taltone's announcements and report, Ms. Wishner, who is our representative to Radnor Reach, has an announcement with regard to that organization.
So Radnor Reach Coffee and Conversation, what our teens are up to and how to handle it, is inviting fellow parents and community members for coffee and conversation for this coming Wednesday, February 20th, from 7 to 8:30 p.m. And this is going to be at the New Leaf Club, which is 1225 Montrose Avenue in Rosemont, which is where the Smith & Hawken store used to be. So it's right across from the same parking lot as Rosemont Pharmacy. And there will be informal conversation and discussion about what our Radnor teens are up to and a brief review of the recent drug and alcohol survey results from the Radnor Middle School and Radnor High School. And in addition, Lieutenant Andy Block of Radnor Police will report on what they're seeing. And for with any questions, there are 2 contacts: Luisa Raimondo, LUISA227 @hotmail.com, or Amy Rubinoff, ARUBINOFF @yahoo.com. And I expect to be able to go to that meeting. And in addition, the March event that REACH was going to do with Ask and Radnor Township School District has been canceled. Instead, they're going to do a series of small events this spring with Speak Up.
Thank you. And with regard to ASK, the Alliance for Safe Kids, as we know, I have been representing the Radnor Township Board of Health at that group, and due to some other commitments during this year, especially the spring, I will be unable to continue doing that. And Ms. McCarthy, Mary Ann McCarthy, has graciously agreed to represent the Board of Health at future meetings of that group, and she will be providing us with reports at our meetings. Thank you, Ms. McCarthy. Mr. Taltone, your announcements and your report, please. Thank you.
Good afternoon and Happy New Year to everyone I haven't seen since January. My report, the first thing I wanted to mention was that the township manager was planning on coming to the meeting tonight to bring the Board of Health up to speed on the deer culling program that's taking place in the township. At the time, I thought that Mr. Hazen wouldn't be here due to another commitment. So I informed him of that, and he wanted to come at a meeting that he was sure that the chairman was going to be here. So most likely he'll be out the next month's meeting, so just to be aware. January is a pretty busy month for me, where we have to renew all the food licenses in the township, which is somewhere around 202. So if you notice, my numbers are a little low. As far as food safety inspections, we did 11. Actually, it's more than that. If I count up till today, it's probably another 4 or 5 more in there. Bathing places are around 7. We had some rental housing inspections that we did. We had an issue with rentals where landlords not providing heat, so it's been keeping us pretty busy. Quality of life issues, we had some issues with some food facilities and some property maintenance related issues. We had 2 cats that came off of quarantine actually this week that were on home quarantine. Last month, the board had asked for some information regarding National School Lunch and the school breakfast program and the farm to school. I printed that out and did some research on it. It's in the packet. So ends my report.
Thank you. Any questions for Mr. Taltone?
I don't have a question, but and I can do this later in our meeting. I did get some information from Commissioner Schaefer, a little bit of an update on the deer culling, that I can share some of the information she gave me.
Well, now would be a good time. Thank you.
Certainly. So the USDA was contracted by the Radnor board, the commissioners, to do 10 nights of the going out and doing the culling. They've done the first 5 nights, and they've culled 115 deers, which leaves 5 more nights to go of deers. And then there was also a private group called the Chester Valley Deer Management Association that did, during regular hunting seasons, culled 64 deers. Now, when I was driving over here, I must have had Dr. Donato's in my brain, because I didn't get the real specifics. I've never actually seen them spelled out as far as the overall contract that they have with the USDA, over how many years, or is it this year? So I will, unless we just wait for next month and see what the township has to say, or I can also follow up with Commissioner Schaefer, whichever you prefer.
Well, Mr. Taltone, did you say that Mr. Zinkowski, the township manager, is going to come here at our next meeting in March?
That's the plan, yes.
Okay, so perhaps we ought to wait for his report. And I'm sure he's providing the same information to the commissioners. Thank you. Okay. At this point, we'll move on to old business. Teen health issues is the first item, and Dr. Leader, if you can give us what may be a final update on this project.
So I can pass this down. This is a copy of the poster that Alexa Lee completed
Your
last
microphone.
year.
Your microphone.
This is the poster that she completed last year and was printed by Kevin Kane from the school district. And I have 20 copies that I brought with me tonight, and I gave 10, I believe, to Marianne McCarthy, who's going to distribute them in the middle school, and Claudia took 10 to distribute in the high school. So I'm going to ask for printing of more, and Genevieve and Amy were helping me come up with some places, and we came up with a list of churches and communities, and you were mentioning the library. So if you have additional places in town that have community bulletin boards or you think might be willing to host one, please let me know. I'm going to work with Alexa to get them out.
Yes, Ms. Schaefer, who is president of the Township Commissioners, the Board of Township Commissioners, took a copy of the poster this evening. She is also on the library board, and so she is going to see that it gets prominent placement there. Great.
We may want to consider the private schools and offering them for their areas when if you're reprinting more and not, and keep them in the loop as well.
Okay, private schools in Radnor Township, by extension, I assume you mean the public parochial schools, as well as schools like Agnes Irwin, and which, to my mind, is more fully a private school than a parochial school. But yeah, do you have a list of those so that we don't miss any? I'm not sure I know all of them within our township.
Dr. Leader and I, I'm sure, can gather that and take care of that when she requests further copies.
Yeah, I'm sure, or someone at the administration building of the school district probably
Yes.
has that information because
Because
they provide services.
We do provide services, yes. So even the nurses could take them with them when they go over.
Yeah, that would be a great route for that. I
Thank
think.
you.
And Amy, I followed up with the woman you referred me to at Bryn Mawr Hospital. I'm going to take a copy over for her on Thursday and see what she's interested in doing. So I'll let you know.
Okay, just so that person who Amy, Dr. Leader is referring to is Gail Wright, who's the head of the community outreach program for Mainline Health Services. So she goes into all kinds of different settings, and plus she has a budget, so she might be able to print some and distribute some. So she's a good contact.
Again, many thanks to all who have brought this to fruition. Another item on our agenda under old business is relates to a request we made of Mr. Kane, the Radnor Township School District liaison to this board, to provide us with information on absenteeism during the flu season, which Mr. Kane was unable, well, actually, the school district is not in session today for President's Day, so Mr. Kane is unable to be with us this evening. So He cannot explain or answer any questions with regard to this, but if there are any or any comments about the information that he's provided, we can certainly send it on to him and he can be prepared at our next meeting to answer those questions. So, any questions about the information?
Well, attendance looks pretty good, so hopefully a lot of people got their flu vaccines. Ms. McCarthy coughs appropriately. And, you know, I don't know. I mean, hopefully, you know, kids actually and teachers actually did stay home if they were sick. But, you know, this is good.
Yeah, I was also struck with the attendance levels being up there, and of course, we shouldn't be too sanguine about it. It doesn't necessarily mean that everybody was healthy. They may have been coming to school ill, which I hope they weren't doing, but it does seem as though, based on the latest information, that the outbreak peaked earlier this winter, sometime before our last meeting in January, and has been on a downward slope ever since, based on what I'm looking at. I don't know if anyone else, Ms. McCarthy.
I've just heard that there's a stomach virus, a different strain going around that drops them like flies, not for long, but that's a 24 to 48 hour that the kids and the teachers get. Not pretty.
Yeah, that's probably norovirus, is that correct? And but unfortunately, there isn't yet a vaccine for that, so. Say that out loud. Say that out loud. We can.
Hand washing, and what I had read and heard was it's actually not even using the Perel disinfectant that works with the norovirus, the strain that's out there, that you really have to do hand washing.
I did like how the numbers actually during what at least we were considering the flu season were higher overall than the generally just a little bit higher overall than the whole year prior. And I don't know if there's other times of the year that, like let's say in the last school year, did everybody get hit hard in February or March? And that's what you were referring to a little bit there. Or is it because of, you know, attendance gets a little worse around, you know, spring break and vacationing or something? But overall, the numbers are good. Just interesting that it looked a little bit better during the supposed flu season. That would have, you'd think it'd be worse.
Well, that's maybe a question we can raise with Mr. Kane at our next meeting. Any other questions on that information? We have in our packets what looks like a wealth of material about an item that we have been discussing for the last couple of meetings, and there are a couple of 2 or 3 members of this board who have formed an ad hoc subcommittee to work on this with the school district, referring to the farm to school programs. And I'm unfortunately just seeing this information this evening, so I'm looking forward to reading it. But did you provide
Well,
us with that?
I mean, one thing, the farm to school program, and this does a good job of describing that really it can operate at a lot of different levels, and sort of depending on what works in a particular area. I mean, I happened to ask my high school age kid about fruits and vegetables in the Radnor High School cafeteria. And I mean, his report is that there's, first of all, he was trying to figure out, was there even any fresh fruit around, or any fruit? Because I said, well, is there even anything like applesauce, which is sort of barely a fruit? And anyway, he and his friends agreed that there was very little fresh fruit, and what there was so sort of bad or in such poor quality, sort of nobody eats it kind of thing. So, but then he said, oh yeah, I eat vegetables, they're in a wrap. So that's like one piece of lettuce or something. So, I mean, I think, without actually talking to people in the school to know more about, which we've been trying to do for quite a while now, to find out actually what arrangements there are, if any, because there may be, some kind of contracting to get some, locally sourced fruits or vegetables, or there may be none. I mean, we don't really know. And not having a superintendent to whom, because we don't have a superintendent right now, it's been hard to, sort of get because we have to get some basic information from the schools to know sort of how things are done now, to know if they're, and I know at the last meeting, I can't remember who brought up, maybe it's you, Dr. Humphrey, who brought up the idea, is there any way of linking with the local gardening efforts? And I mean, I think that's a great idea. Maybe is you, Dr. Leader. I'm not. Anyway, whoever brought it up, it's a good idea. So.
2 meetings ago.
Okay.
I wasn't here.
So, whenever that group meets for, I assume there's some sort of early spring or late winter meeting, it would be nice to see if there's some thought amongst people who do the gardening, if there's some way to, when it gets into the fall, when school's back in session, if there's any way to kind of donate produce or, sort of involve the schools. I mean, I would sort of think kind of at the very least there are cooking classes at school, so even if that were like an entree of sort of donating some things for the cooking classes to use, that might be sort of a foot in the door, and maybe trying to get those teachers involved with seeing, is there something else that could be done, or could they do demonstrations for the school, or, maybe perhaps that's another sort of avenue of getting into this.
Did you email or consider my suggestion of contacting Michelle Meehan directly and ask for a meeting rather than waiting and just say, we'd like to have a meeting to discuss the contracts as I pursue, or as the Board of Health pursues this? Very, very simple. And it would be michelle.meehan@rtsd.org.
Okay.
And she's, her office is in the middle school.
So you don't feel like I need to, because partly I felt like I thought I might need Mr. Kane's involvement since he's the theoretical liaison from the schools to here, but you think it's fine just to go ahead and meet with her?
Well, I would hope we wouldn't be stepping on anyone's toes,
Okay.
but there is an acting superintendent, so you could copy the acting superintendent.
Who is that? Do you have a name?
Yes, I do, and luckily I'm retired, so it is, give me a minute.
That's all right. You can,
Whoever was the assistant.
if you can email it to me, I'd appreciate it. I don't know who
But that's, that I think even as a resident, you could do that. Not even being on the board, I would believe that you could have these discussions. If you would like, I would open that door for you and set up a meeting. I don't know what your availability is and what her availability is, but she's lovely, and I would hope.
Okay, that'd be great.
So I'll do that,
Yeah.
and you'll just have to tell me when you're available, that kind of thing, and we'll get a couple times, and we can go meet with her and answer all these questions that you've been having for so long. That may. And the second thing is, did you read the Great Valley piece that I sent you?
Yeah,
So they do it and
Right.
do it well,
right.
but different than what you're thinking. But it's still another way. There are many roads lead to Rome. So, you know, they've been doing it for a while. So we clearly are behind.
Although we may be doing things that I don't know about. So I don't want to assume, you know, either that we're doing things or we're not doing things, because I don't know. So
Okay.
I'm available generally, you know, because I have a regular job, so either early or late, as opposed to the middle of the day. I could work around that most easily.
In terms of the connection to the community garden, it is timely that you mention it because there is a early planning meeting this week on Wednesday. And so I can mention that. We did donate pounds, 1,000 pounds or some amount of produce last summer. It's kind of hit or miss whatever is in the bucket that week, and a lot of it is in the summer. But I think the issue is worth raising and at least trying to have that connection. So I can be willing to start that discussion unless Dr. Humphrey, I don't know if you have connection anyway.
I was just going to say that this last year was the first year for the community garden, so a lot of things that need to be ironed out. But a lot of donations were made at that time. I don't know if there's anything directly in the schools.
Did it all to where did it go? To Phil Abundance. It went to Phil Abundance, so nothing came back into Radnor. But it's an interesting idea, and it's worth having the discussion. So I'll start that on Wednesday. I'll let you know.
Okay, thank you, and we'll look forward to getting some more information at our next meeting. I want to return to the issue of the flu because looking through the minutes, I realized that we had asked Dr. Foreman to prepare a paragraph on the flu, which he did, and that was sent out through the township's Red Alert email system. And my understanding is, Mr. Taltone, correct me if I'm wrong, that you have to actively decide to subscribe to the Red Alert system in order to get it. Is that correct?
That is my understanding, yes.
Is the township proactive in terms of alerting citizens that this Red Alert system exists?
That
and
availability,
how to subscribe?
yes, that availability is on the township's website. And, you know, there's a link where you can sign up. So any resident can sign up so that they can get the alerts.
Okay, then, I don't know how many of my colleagues here on this board are interested. I did sign up, and you do get some interesting information. The Radnor Township Police Department is especially assiduous in keeping us up to date on crime waves in the township and that sort of thing, so I'm saying that facetiously.
I'm sorry, is this a email or the phone calls?
This is email. Phone calls, we learned following our request to have a phone call go out, that is reserved strictly for emergencies, and the flu situation had not yet in Radnor Township and has not risen to the level of an emergency akin to Superstorm Sandy, for example, when a lot of alerts did go out over telephone. So that's a very expensive, in my understanding, a very expensive way of communicating with people. But in the event of a true emergency, the township does go that route. For other things, the Red Alert system seems to work, but as I've indicated, you do have to subscribe to it. And again, the township's website has information as to how citizens can subscribe to this red alert email. And I would encourage everyone to look at that and determine if that's something you want to do. Any other old business? Is there any new business for tonight's meeting? Ms. Wishner?
I just wanted to sort of check in about the Radnor Health Matters, cable TV, to see if people had ideas of topics that we should be including on that. And I had one particular topic I wanted to suggest, which would be to get Ed Klein, who's the Delaware County Emergency Services person, to come on. And there is just a wealth of different kinds of trainings and events and drills that the sort of different aspects of the emergency services or Medical Reserve Corps offer. And I think it would be interesting for him to kind of outline what the whole system is, because it's a kind of a complex system, and to have it explained in one place at what time, okay, here's what FEMA does, here's what the Medical Reserve Corps does, here's what the emergency services does, and here's how those different things get activated. So I wanted to suggest that in particular, and I don't know, Herb, if you still have time to do those. I mean, I'd be happy to do that, or and also I just wanted to check in what other topics people might be interested in.
Okay. I would appreciate it if you would follow up. You know Mr. Klein?
Yes.
And contact him and get some dates. It's usually a half an hour works best. And, you know, I can go over the process with you in case well, you've done this before, so you know. With regard to Radnor Health Matters, I had worked to schedule something with Dr. Foreman and Dr. Avedian, the county's senior medical advisor, to do a program on the flu, but we agreed that at that point we saw that the peak was passed, and we agreed that there was already a lot of information out and there wasn't much need to do that. But of course that could change and we could do something else. But yeah, any issues or topics that will help enlighten our citizens about health matters, certainly. Well, we'll do this one. Go ahead. Go ahead.
Just two sort of things happening nationally that may have some, effect locally. One is that the National American Academy of Pediatrics came out with new recommendations regarding diabetes mellitus and diagnosis and treatment in children and adolescents who are overweight and obese. Along the lines of kind of earlier medication and not relying so much on trying increased activity, and sort of more guidelines about what medications to use when. So that's one thing. And the second thing is that Center for Science and the Public Interest, which is based in D.C. and has been very active in a number of nutrition issues, they have launched a campaign to try and lower the sugar content in sodas. And so that may be something that we're seeing something about. In addition, I noticed, maybe it already happened or it's happening this week, they're showing the movie Bully. And apparently, sort of just unrelated, not really related to that, but I've been doing some work around bullying and obesity, because apparently sexual orientation and overweight and obesity are the two most common reasons for kids to be bullied. And even when overweight and obese kids lose weight, apparently that bullying still can continue. And there was a recent article in the American Academy of Pediatrics journal called Pediatrics in January with the the director of research for the other than the Center for Science and Public Interest, the other big national sort of nutrition advocacy research organization is the Yale Rudd Center at Yale University. And so the head of that, Dr. Puhl, P-U-H-L, wrote this article about bullying, or summarized research, and plus had some original research about bullying and obesity. And I'm going to be having her do a teleconference for the Pennsylvania chapter of the American Academy of Pediatrics on this topic, which I can certainly let people know about. She's a PhD. And the other person on that teleconference will be a pediatrician who's been a leader in school bullying programs in the state, Dr. Masiello. So that may be of potential interest, and I can certainly let people know when this webinar, and it will be live webinar, plus it will be archived for listening to at a later date.
Great.
As you may recall from my visits last year when I sat out in the audience, the middle school has an anti-bullying lesson, one each quarter, so 4 per year, specific to the grade level. And they're often a culminating anti-bullying day. There is a zero tolerance in the Radnor Middle School. It is done through the health education classes, and that may be something that you or whoever is in charge, I mean, I taught them, and they're co-taught, and that's the beauty of them, unless things have changed in 4 months. They're co-taught with the health teacher and the administrator, or the health teacher and a guidance counselor specific to that grade level, so that the point of co-teaching, not that you couldn't do it yourself, but the reality is to have the importance of anti-bullying, that an actual principal would take time out of their day and be in a classroom several times, or your guidance counselor, and to show, and the activities are very, they change, you know, through the years we've tweaked them, and so that may be a good starting point if you are interested in the Radnor's attack on bullying.
Well, I think that's certainly a very interesting approach, and there are a lot of health issues that affect our kids. It happens that this year is a year in which the U.S. Centers for Disease Control and Prevention is conducting its biannual Youth Risk Behavior Survey. Now, I don't believe that Pennsylvania, by and large, yet participates as a Commonwealth across the board. However, the Radnor Township School District has, at the middle school and high school levels, conducted its own similar survey. And I think what we need to do as a board is to identify who in the district is the point person for making sure that this survey takes place, what questions are on it, when do they administer the survey, which is done anonymously, and then how can we work together to look at the data that results from the survey, analyze it, and figure out, because the data is only good if it serves as a policy guide for school district administrators to develop programs that address the issues that are affecting our kids. So I think there's a series of steps, and I'm sure that the Radnor Township School District is once again doing it. I'm saying I'm sure, but I'm not really.
Well, many years ago, we started writing that with a team of PhDs from Drexel.
Yeah, I know. I was part of that.
Right. So, and I was as well.
Yes, I know.
As the, health person. It is administered and it is anonymous. We take our classes to the computer lab, and the data is analyzed, and there is an evening where parents can come. And I know Esther Purnell, who's an assistant principal, it has been one person who has delivered the results and what the problems were, et cetera. And that may be a very good tool for us to assist in picking, whether it be speakers or programs, and what to back, and what the Ask group can go through. We're actually data driven from what the students have said. So believe it or not, we're ahead of the curve, or we were. And I'm most hopeful that it's still being administered, and we can find that out. We can find whatever you'd like me to do, sir.
Well, maybe we can divide the labor. If you can find out through the middle school, where you know all the players much more intimately than I do, and I'll follow up with the high school. And one of the key questions is, where are they in the process at this point? Have they formulated all the questions? Because some of the issues we talked about this evening, diet and bullying, are certainly amenable to questions that will elicit some answers that will help us to see where we are right now, and develop and help the district develop policies and programs that address bullying or diet, that sort of thing. I don't know if that makes sense to everyone, but I know that the Philadelphia School District is participating with the CDC as a standalone district, and they are in the process. They've already begun. The CDC has already begun with their nationwide program.
And I guess sort of also, where are the data? Where are the results? Are they, how does one access them?
Yeah.
Well, possibly we should, whoever you delegate, craft the same letter to the acting superintendent, who I know who I think it is, but I don't want to say it in public in case she didn't get it. But asking for this. Mr. Kane, I would imagine, would.
Before we do that, what I'd like to do is to try to simplify the process a little bit, so we get some feel for where the district is now, right now, is, again, as I've suggested, if you could contact, could be the middle school principal, Anthony Stevens, or I'll contact the Mr. Skellinger, the high school principal, and see, just to try to get a sense of where they are in terms of doing a survey in 2013. Thank you. And then you and I will be in contact after we've done that.
I have a question. Is the survey that the school is doing, is that the same survey that the CDC put together? Or, I mean, it seems like if the CDC put together a pretty comprehensive survey, I'm not I mean, maybe this goes back so far, this is a moot issue, but it just seems, and I mean, can you compare the apples and oranges of what the CDC is doing and what Radnor's doing?
The survey is not entirely identical, or it hasn't been in the past. There's no reason why it couldn't be identical. The reason the Radnor Township School District is doing their own is, as I've indicated, for whatever reason, the Commonwealth of Pennsylvania does not, across the board, participate in the CDC survey. And so several years ago, as Ms. McCarthy has indicated, some of us got together and worked up an alternate to the CDC's program. The Philadelphia School District has done something similar but different. They're working more closely with the CDC. but they do issue their own report.
Amy, given the momentum that this topic has right now, might this be a topic for Radnor Health Matters? Or do you think it's covered sufficiently?
You mean? Bullying. Oh, yeah, sure.
Seems to be gaining a lot of momentum, and it seems like there's a lot going on, at least in the middle school. Just a possibility.
Yeah, no, it's a good idea. I would have to figure out sort of locally who would be the appropriate people to do it, but it's a very good idea.
A physician at Children's Hospital, Ken Ginsberg, has been out here recently and worked with the Alliance for Safe Kids group on related issues. Dr. Ginsberg's specialty is adolescent medicine, and he may be someone that we could reliably talk to.
Well, I've been trying to curb my enthusiasm, but my goal since I took my first job in this township in 1974 is that the school district believe and embrace the fact that the most important thing is our children's health. And rather than just have these sporadic TV shows or half-hour blurbs or whatever, and I'm not sure if I'm supposed to say this out loud, but you'll have to excuse me because I'm new. I'm sitting here because we were thinking of a project for Claudia, and wouldn't it be wonderful, theoretically, if on Radnor TV, the high school station, they had a half-hour segment on health issues? Now, obviously, we'd have to contribute to that but just so it comes to the forefront, and it's not the last thing we think of, and we only deal with it when someone is sick or they have an emotional issue. I would rather us be the proactive, if that's what I've been, and that's what I would hope we could do. And we have the avenues. I just don't think that they're being. You see everything else on Rad TV. Am I right, Claudia? I certainly do. But wouldn't it be wonderful if we had a little health clip each? 15 minutes. The kids are great. The kids could do a Claudia, poor thing, in public. I'm thinking of out loud for projects for you. But with that face and that smile, who wouldn't believe her? So there's a thought for the board. Thank you.
Thank you. Okay, any other?
One more thing, we also have the 30-minute segment that Ms. Moser Mills did, which is more about teen health topics, and is a 30-minute. It's on a DVD and a CD, and I know there's a copy here. So if we were to slice that, that's done, and that's Allison Moser Mills and other students in Radnor. That if you want to consider using that in any way, we certainly can. That's available. That's already produced.
Isn't that still on the township's website, Mr. Taltone?
I believe we have a disc for it, but I'm not sure if it's still on the website. We can find out.
Thank you. Yes, I appreciate that. Mr. Yeah, that's what I thought. They're in perpetuity. When we're all piles of radioactive dust, those programs will still be on. Okay, any other items for discussion this evening? We've really got a lot to follow up on. And I'm not forgetting that we're all volunteers. There is no public participation, since there is no public here tonight. This board does meet usually on the third Monday of every month at 5:00 p.m. here in the Radnorshire room of the Township Administration Building. Our next meeting is scheduled for Monday, March 18th, 2013, at 5:00 p.m. Look forward to seeing everyone turn out. Thank you. This meeting is adjourned.